A heart attack, or myocardial infarction, MI, is a critical medical event that occurs when a portion of the heart muscle is damaged or dies due to a lack of oxygen-rich blood flow. The primary scientific reason for this blockage is almost always related to underlying cardiovascular disease. Here are 10 scientific reasons and associated risk factors that contribute to a heart attack. Atherosclerosis and plaque rupture. This is the most common cause. Atherosclerosis is a disease in which plaques made of fat, cholesterol, and other substances build up on the inner walls of the arteries. Over time, these plaques can harden and narrow the arteries, a process called coronary artery disease, CAD. If a plaque ruptures, it can trigger the formation of a blood clot, thrombus. This clot can then completely block the artery, stopping blood flow to a section of the heart muscle and causing a heart attack. Coronary artery thrombosis. Directly related to plaque rupture, thrombosis is the formation of a blood clot within a blood vessel. When a plaque in a coronary artery breaks open, the body's natural clotting mechanism is activated to heal the injury. High cholesterol, dyslipidemia. High levels of low-density lipoprotein, LDL, or bad cholesterol, contribute significantly to the formation of atherosclerotic plaques. As LDL cholesterol accumulates in the artery walls, it promotes inflammation and plaque buildup, increasing the risk of a rupture and subsequent heart attack. High blood pressure, hypertension. Chronically high blood pressure forces the heart to work harder to pump blood. Over time, this can damage the coronary arteries, making them more susceptible to atherosclerosis. Hypertension can also directly damage the lining of the arteries, further increasing the risk of plaque rupture and clot formation. Diabetes. Mellitus. Both type 1 and type 2 diabetes are major risk factors. High blood sugar levels over time can damage blood vessels and nerves, leading to accelerated atherosclerosis. Diabetes is often associated with other risk factors like high blood pressure, high cholesterol, and obesity, compounding the risk. Tobacco use. Smoking and exposure to secondhand smoke are incredibly harmful to the cardiovascular system. Chemicals in tobacco smoke can damage the lining of blood vessels, promote plaque formation, and make the blood more likely to clot. Nicotine also causes the heart rate and blood pressure to rise, putting added strain on the heart. Obesity. Excessive body fat, particularly around the waist, is linked to a higher risk of heart attack. Obesity is a key contributor to metabolic syndrome, a cluster of conditions that includes high blood pressure, high blood sugar, and high triglycerides, all of which significantly increase the risk of heart disease. Physical inactivity. A sedentary lifestyle is a significant risk factor for a heart attack. Lack of regular physical activity contributes to obesity, high blood pressure, high cholesterol, and diabetes. Coronary artery spasm, also known as Prinzmetal's angina. In some cases, a heart attack can be caused by a severe temporary spasm or tightening of a coronary artery. This spasm can constrict blood flow, even in the absence of a complete blockage from plaque. This is a less common cause but can be triggered by factors like stress, illegal drug use, such as cocaine, or exposure to extreme cold. Genetic and hereditary factors. A family history of heart disease, especially a heart attack at an early age, such as a male relative under 55 or a female relative under 65, significantly increases an individual's risk. While lifestyle choices play a crucial role, genetic predispositions can influence factors like blood pressure, cholesterol levels, and the overall health of blood vessels. Understanding these risk factors is essential for prevention and early intervention.